Hey there, health warriors. Welcome back to our channel, where we decode complex health topics and bring you the latest insights in a way that's super easy to understand. Today, we've got a special video lined up. We're diving deep into a topic that often flies under the radar but affects millions worldwide: lupus. Now, lupus isn't just a one-size-fits-all condition. It has 4 distinct types, each with its unique challenges and treatment approaches. So, if you're ready to unravel the mystery of lupus with us, make sure you stick around until the end. And hey, if you haven't already, hit that subscribe button and bell icon to stay updated on all our latest content. Let's jump right in. The 4 types of lupus. First things first, what exactly is lupus? Well, lupus is an autoimmune disease where the immune system goes a little haywire and starts attacking your own tissues and organs. It can be tough to diagnose because its symptoms often mimic other diseases. But understanding the different types of lupus is crucial to getting the right treatment. Type 1. Systemic lupus erythematosus, SLE. Alright, let's dive deeper into systemic lupus erythematosus, commonly known as SLE. This type of lupus is quite the chameleon, manifesting in various forms and impacting people differently. It's like a shapeshifter, unpredictably affecting different body parts. From your skin, which could develop rashes or lesions, to your joints, causing pain and swelling. SLE doesn't hold back. But it doesn't stop there. Oh no, it goes further, possibly targeting your kidneys, brain, heart, and lungs. Imagine your body's immune system, which is supposed to protect you, turning into a frenemy and attacking your own tissues. That's SLE for you. Now, you might be wondering, how do people live with such a wildcard disease? Well, it's a journey, a mix of self-care and medical intervention. People with SLE often have to balance their lifestyle, making sure not to overdo it. Rest becomes a best friend, and avoiding sunlight is a common practice, as UV rays can trigger flare-ups. But let's not forget the power of community and support groups. They're like beacons of hope, offering emotional support and sharing experiences. Speaking of medical interventions, the last few years have seen impressive advancements in the treatment of SLE. It's no longer a one-size-fits-all approach. Researchers have been working tirelessly, and thanks to them, treatments have become more tailored. New medications targeting specific parts of the immune system have emerged, offering hope and better quality of life for those battling SLE. These treatments aim to reduce flare-ups and protect organs from damage, which is a game-changer. In a nutshell, SLE is a complex disease, but with the right balance of care, support, and modern medicine, living a fulfilling life is more than just a possibility. It's a reality for many. The journey with SLE is challenging, no doubt, but with each step, we're moving towards a future where this enigmatic disease can be managed more effectively. Type 2. Cutaneous lupus erythematosus. Alright, let's dive deeper into cutaneous lupus erythematosus, a type that really puts lupus in the spotlight, quite literally on the skin. Now, if you've ever come across images of individuals with lupus, you might have noticed those unique, often striking rashes. And the most famous of these, the butterfly rash across the cheeks. It's like a hallmark of cutaneous lupus, making its presence known loud and clear. It's not all about appearance. These rashes, while visually distinctive, pack a punch with discomfort. They can be downright painful and irritatingly itchy. And if you're thinking, well, how do they figure out it's cutaneous lupus? You're not alone. The road to diagnosis involves a mix of clinical evaluation, skin biopsies, and laboratory tests. It's like piecing together a puzzle to see the complete picture. Treatment plans are tailored to each individual, aiming to tame the symptoms and prevent flare-ups. This might involve topical treatments, like corticosteroids or even antimalarials. Yeah, you heard that right, antimalarials. The goal is to keep those rashes in check and improve the quality of life for those living with this type of lupus. It's a journey, but with the right approach, it's a manageable one. Type 3. Drug-induced lupus erythematosus. This form of lupus, you see, doesn't just pop up out of nowhere. It's triggered by specific prescription medications. It's crucial to know which drugs can be the culprits behind this condition. The intriguing part about drug-induced lupus erythematosus is that it's a bit of a chameleon. It can mimic the symptoms of systemic lupus erythematosus, the more common sibling in the lupus family. However, the key difference lies in the cause and, thankfully, its reversibility. Once the offending medication is stopped, the symptoms usually do an about-face and resolve, much to the relief of patients. Now let's talk about the drugs that can trigger this condition. Common culprits include certain blood pressure medications, antibiotics, and even some drugs used to treat chronic conditions like rheumatoid arthritis. The million-dollar question is, why do these drugs cause drug-induced lupus erythematosus? It's like they flip a switch in the body's immune system, leading it to mistakenly attack its own tissues. But the good news is, with proper medical guidance and monitoring, this condition can be managed effectively. So, while it's important to be aware, there's no need to hit the panic button just yet. Type 4. Neonatal lupus. Alright, let's dive deeper into neonatal lupus. This particular type uniquely targets the newest and most vulnerable among us, newborns. Now, the first thing to know is that it's linked to mothers who possess certain autoantibodies. Sounds a bit ominous, but most of the symptoms are surprisingly mild. In fact, they often resolve without any major intervention. The common symptoms of neonatal lupus can range from skin rashes to blood abnormalities, and occasionally liver problems. But don't let that dampen your spirits. The medical world has come a long way in understanding and managing this condition. Regular monitoring and timely treatment can work wonders. The goal? To ensure these tiny tots don't just survive but thrive. Pediatricians and neonatologists often keep a watchful eye on these little ones, charting their growth and development, always ready to step in if needed. The treatment usually involves a team approach, encompassing not just medications, but also a lot of TLC, tender loving care. And while the thought of a newborn facing any health challenge is heart-wrenching, the journey of neonatal lupus is often one of resilience and hope. With the right care, these babies often grow up to live healthy, normal lives, a testament to the remarkable strides made in pediatric healthcare. So, while neonatal lupus might sound daunting, it's a path well-trodden by medical experts, lit by the beacon of modern medicine and compassionate care. Conclusion. All right, folks, that wraps up our deep dive into the 4 types of lupus. It's a complex condition, but understanding these different types can help in early diagnosis and effective management. If you or someone you know is battling lupus, remember, you're not alone. There's a whole community here to support you. And if you found this video helpful, don't forget to give us a thumbs up, share it with someone who might benefit from it, and of course, subscribe to our channel for more content like this. Stay healthy, stay informed, and I'll see you in the next video.